Hi, I'm Dr. Anndrea Hatcher from Olive Branch Parke Veterinary Clinic, and today I'm going to talk about garter snakes. Garter snakes at their adult length can get up to 3 feet long. Their enclosure temperature range should be 75 degrees Fahrenheit at the cool end and 80 to 85 degrees Fahrenheit at the warm. Overnight, it should not be cooler than 70 degrees. Their humidity should be 30 to 50%. They should have a moist hide, and you should mist the cage when they're close to shedding. They are crepuscular, which means they are most active at dawn and at dusk. Their lifespan is 6 to 20 years, with an average of 8 years. As far as their enclosure, hatchlings and juveniles should be kept in a smaller tank, such as a 5 to 10 gallon aquarium. Adults should be kept in a 15 to 20 gallon aquarium. It should have a secure, tight-fitting lid to prevent escapes. The equipment that you'll need if you're going to be keeping a garter snake is a spray bottle for misting the cage when it's close to time for shedding, a shallow water bowl for soaking, multiple hides. You'll want one at the warm side and one at the cool side of the enclosure. For heating, under-tank heaters under 1/2 of the tank is most recommended. Heat rocks are not recommended because of the burn risk. Due to the nature of these snakes, UVB bulbs are not necessarily recommended. For a substrate, paper towels, newspaper, carpet, and aspen wood shavings work well. Do not use cedar. You'll also want tongs for feeding thawed prey. For food, you can feed thawed pinkies for juveniles and smaller snakes. Some can eat thawed adult mice. Do not feed prey that is larger than the widest part of the snake. They can also be fed feeder, guppies, or platies. They can also eat earthworms. If they're fed worms, they will need to be fed more often because they're not as filling as mice or fish. Feed worms cut in half twice a week. Give about as much as they will eat in 10 minutes. Shedding occurs every few weeks to months. All reptiles may carry salmonella, which may cause disease in humans. The young, elderly, and the immunocompromised are most at risk. So always wash your hands after handling reptiles. New snakes should be examined by a veterinarian and have a intestinal parasite exam done, and then they should have this repeated once a year.